All right, thank you guys for coming tonight. This is the third one that I've done of these, so I think I have everything memorized I need to say, but please ask questions as we go. It's really great to have a conversation throughout this instead of me just talking. So shout out a question, raise your hand, whatever you feel comfortable with, it will be fine. So the title of our presentation, Medicare, It's a Lot. We named this after I did all of the slides because I think when I presented it to my coworkers, somebody said, wow, that's a lot. I'm like, you know what? That's a perfect name for our presentation because it is a lot. So you made a good first step by coming and learning about the basics tonight. A disclaimer I want to go over with you. We are not affiliated with representing Medicare or any other insurance carrier at this event. This is purely educational. If you want to talk about any type of specific plan or carrier that your neighbor, friend, spouse has told you about, I can't talk about any of that tonight. It's specifically educational purposes only, but we can talk later. As I said, educational only, no sales event. There's no obligation to come to me as your broker to purchase any insurance after this event. If you know somebody who is a broker or you go direct to carrier, that is fine. We suggest that any questions that require legal or financial advice that you please consult your attorney, accountant, or financial advisor. You'll see that some of the information in here is intertwined with income. So if you have any questions that you think you might need to ask about your income or how taxes would be handled, that's above my pay grade and scope of what I do. So talk to your accountant or your financial advisor. Okay, so 8 topics that we're covering tonight, and then we'll have question and answer. But as I said, you can ask questions as we go through this. Don't feel the need to wait until the end. If you do want to wait till the end, feel free to write down your questions on those notepads because maybe it would be answered later in the presentation. But again, just shout out any questions as we go. All right, Medicare basics. In order to be eligible for Medicare, you have to be age 65, or you can be eligible for Medicare due to disability. It would start on your 25th month of receiving disability benefits. So your eligibility starts the first of the month of your 65th birthday. So when you would get your Medicare card in the mail, if you had an April birthday, your Medicare effective date is going to be April 1st. If your birthday was April 1st, then your effective date's going to be March 1st. Okay? We'll talk a lot about the phrase, and you'll hear me say original Medicare throughout the presentation. Original Medicare is Part A, which is your hospitalization, and Part B, which is your medical, or I like to call it your outpatient or physician benefit. We'll be talking about this more in detail, but Part A, pretty much everybody, whether you're drawing from a spouse or because you've worked, you don't have to pay for Part A. Part B is the part that you do have to pay for. There are some instances if you are at a lower income level where you can get your Part B subsidized, and we'll go over a little bit of that more. Right now for 2022, the cost of Part B is $170.10 per month, but there is this thing we call IRMA that we'll get into in a couple slides here too, and that's where the income information comes into play. So if you're a higher wage earner, you might have to pay more for your Part B than people that do not earn a higher wage. Cost of Medicare, as I said, Part A is generally no cost to you because you've paid in over the course of your life, or a spouse has, into the Medicare program. If you do have to pay for it, it's $4.99 a month if you've worked less than 30 quarters, $274 a month for 30 to 39 quarters. And again, non-working spouses, you can use your spouse's benefit if you did not work or pay into the Medicare system. Part B, base premium $170.10, and we're going to go over IRMA on the next slide. How you pay your premiums, 2 different ways. If you are drawing your Social Security benefit, that will automatically come off of your monthly amount. Okay? If you are not, you will get billed on a quarterly basis. So they do not do monthly billing. You can pay through, if you have a Social Security account, you can go in and pay your premiums online, but you will get a bill in the mail to your home address that they have on file. Any questions so far? Lots of notes. You guys are taking notes. Come on. There we go. Okay. I won't go over this in too much detail. There is in your folder some 2 sheets about this IRMA. It applies to Part B, which is the medical side of your Medicare, of original Medicare, and also for Part D, which is prescription. We'll go into Part D in more detail, but if you are a higher wage earner, you could potentially be paying more for your Part B and your Part D. So the base premium for 2022, if you are an individual filing and you make or reported $91,000 or less on your tax return, you're at the base premium. If you file jointly, it's $182,000 or less, and you're at the base premium. One thing to point out, these are based upon your income from 2 years ago. So for 2022, they are looking at your 2020 income that you reported to the IRS. So if you are aging into Medicare next year, they'll be looking at 2021's income. So there is, like I said, there is Part B and Part D IRMA sheets in there. All right, a little bit more about original Medicare. Part A of hospitalization includes inpatient hospitalization, skilled nursing facility care. With skilled nursing facility care, you have to be in the hospital as an inpatient for 3 days before Medicare will approve any type of payment for a skilled nursing facility stay. There is some home health care covered also. Hospice, inpatient drugs, and hospital meals. This is not an all-inclusive list, but it's just some of the items on an inpatient basis that are covered. You'll see that it's what's not listed under here is any type of surgical or physician fees, because that's covered under your Part B. So anything a physician themselves bill would be covered under Part B, including your doctor's visits, outpatient surgery, physical therapy, durable medical equipment, which is like oxygen, crutches, that type of thing, ambulance, ER, urgent care, lab and diagnostic testing, and preventive care is covered under Part B also. So it's pretty, the way I always remember it, A, inpatient, B, outpatient, even though they're labeled as hospitalization and medical. So if you just have original Medicare, Parts A and B, there are copays and deductibles that you would have to pay if you use medical services. So your Part A deductible is $1,556, and I apologize, that's kind of small. Then if you're in the hospital for more than 60 days, then you have a 0 copay for days 61 through 90, $389 for days 91 and beyond, and $778 per each lifetime reserve day. If you want to get into more detail about what that means with me, I'll be glad to, but it is very complicated with the lifetime reserve days. It's basically, if you go beyond 365 days of those lifetime reserve days, then you're responsible for all costs for your hospitalization. Never in my 15 years have I had a client that has gone through their entire hospitalization benefit. Part B deductible is $233 per year. That's for this year. It does go up each year a little bit. And then generally 20% after that deductible is what you would be responsible for. The only place that would not apply would be for Medicare approved preventive care and testing. So annual mammograms, colonoscopies, those type of things that are on their preventive schedule would not apply to this deductible and coinsurance. Okay. So this is Medicare Parts A and B, what we call original Medicare. So if that's what you had, this would be what you pay. Some things that Medicare does not cover is long-term care. So we talked about skilled nursing facility. They'll cover that up to 100 days. After that 100th day, it's no longer covered by Medicare because it's considered long-term care. So hopefully you're either able to go home or you would be admitted to the nursing home as a long-term patient. It does not cover routine hearing, vision, or dental, routine foot care, home modifications, or cosmetic elective surgery. Again, not an all-inclusive list, but these are the things that we run into the most. Especially some weird examples of the cosmetic elective surgery. I had a client who asked about getting a skin tag removed on her face, but because it isn't in the way of her eating, breathing, or seeing, it would not have been covered by Medicare. Okay, so we just talked about original Medicare, Parts A and B, and the copays, deductibles, coinsurance, your amounts out of pocket that you would have to pay. You hear about Part C of Medicare, they're talking about Medicare Advantage plans. Those are plans that are sold by private insurance companies that are not part of the Medicare system. They are contracted to sell the plans with them. In our area, probably the most popular is Geisinger Gold. Geisinger Gold is a Part C Medicare Advantage plan. So if you decide to do a Medicare Advantage plan and do Part C, you continue to pay your Medicare premiums. They call this an all-in-one alternative to original Medicare because it includes your Part A benefits, it includes your Part B benefits, and it also includes prescription drug coverage in most cases. A lot of your insurance that you have now is probably labeled with a PPO or HMO. That's what Medicare Advantage plans are also. Most of them are PPO or HMOs. And when you see that, that means you need to use the doctors and facilities in that plan's network. So that can restrict you, or it can not, depending on the plan that you choose and what type of plan that it is. If you just have original Medicare, you can go to any doctor, hospital, or facility that accepts Medicare. So in this area, that's everyone that I know of. Some of these Part C plans may cover extra services like your vision, dental, and some wellness programs. So Silver Sneakers is one of the ones that a lot of people call me and ask for. Again, it may cover them, but it doesn't mean that all of them do. So if you're shopping for these plans, you want to look at your benefit summary and see what you're getting with your plan. These are the plans that you hear Joe Namath and what's the other guy? JJ Walker on TV saying, you know, get all your benefits, get money back on your Part B, get this, that, and the other thing. You may or you might be eligible for this, that, and zero cost, zero this, and everything. They are heavily marketing these through third parties, organizations. I'm sure you guys, if you're approaching 65, you have gotten calls already about these. They say, give us your zip code, we'll tell you what they offer. That's what they're calling about. They're calling about these Medicare Advantage plans. They do vary in cost benefits and network based on the company and plan that you choose. I was just at a seminar today, and the amount of plans and information and everything that's available in this area is just abundant. So if you are shopping on your own, be very careful that you choose a plan that has the benefits that you need and want, and that has the doctors in your network. Okay. As a broker, that's what I do. I help you find those plans that fit your needs. But again, be very careful with that, because not every plan offered in your zip code might not include every doctor or hospital that you want to be able to go to. So Part D, I've mentioned a couple of times, it's prescription drug plan. You can get the Part D coverage a variety of ways. You can do what they call a standalone prescription drug plan. That's a separate policy that is just your Part D prescription coverage. Okay. Medicare itself does not offer a Part D. There are also private companies that contract with Medicare to make these plans available to you. So when people say, I get my Part D through Medicare, or I get my drugs covered through Medicare, not really. It's through these separate drug plans. Each plan has their own formulary. A formulary is just the list of drugs that they cover and then what level they cover them at, whether they're generic or brand or specialty drugs. Your costs are going to vary based on what level or tier that those drugs are in. Whether they're brand or generic is going to vary your cost also. Part D can be part of Medicare Advantage plans. We call those MAPDs, Medicare Advantage Prescription Drug. You cannot have a Medicare Advantage plan that does not have prescriptions and a standalone prescription drug plan. Medicare, CMS does not allow you to group those two separate policies. You have to have the Medicare Advantage prescription drug plan together or just the prescription drug plan with original Medicare. I have a lot of people ask me when they're first eligible and come to me and say, well, I don't take any prescriptions, so I don't need a drug plan. Okay, true. But if you do not enroll when you are first eligible, you can be charged a penalty. Right now, it's 1% of the national base premium, which is 33 cents per month. So if you go a whole year without a prescription drug plan and you were eligible to be in a prescription drug plan and then enroll in one, you're going to be 33 times 12 added onto your premium for the rest of the time that you have that prescription drug plan. Plus, even though you might not need a prescription drug plan when you're first eligible, you might a couple months down the road. You never know health insurances to cover what you know and what you don't know. So it's always my recommendation to cover yourself with that Part D plan. How many people have heard of the donut hole or coverage gap? No horror stories? You haven't heard anything? Okay. So there's stages of the prescription drug plan. And the first stage is your deductible, then it's your initial coverage level, and then the stage 3 is the donut hole. The government, Medicare, has worked to close that coverage gap over the past couple of years. But when you look at your cost of a prescription drug plan, you'll see that your prices of your prescriptions might vary depending on what stage you're in. And we'll talk about that in more detail too. And also, as I'm going through this, it's a lot, like the presentation says. But when you start to look at plan specifics and how the plans work with you and what you need, it becomes a lot less complicated when you specify it down. Okay, so here's the stages that I was talking about. Right now, the coverage that all of these Part D plans have to model themselves against is right here. Some might look different. Some might not have that high of a deductible. The deductibles might only apply to brands. But generally, you have a $480 deductible, which is the 2022 deductible. During the deductible stage, generally, you pay the full price of your drugs. Once you get to stage 2, you're going to be paying a copay or coinsurance. So you pay a couple bucks for a generic or 25% for a brand. And that's up to $4,430. Once you reach that number, then you're in this donut hole coverage gap until your cost of your prescriptions reach $7,050. Once you get through that and you're at $7,051, you pay no more than 5% of your prescription cost, which is called the catastrophic level. It takes a lot of prescriptions or a couple of very expensive prescriptions to get to stage 4. I'm not saying it doesn't happen, it does. But you see most people stay in this area with their drugs. And again, each plan that you pick or shop for is going to look slightly different than just this model coverage. Any questions about that?
Yeah.
Go ahead.
So you have total cost there. That's the cost paid by the member and the insurance?
Yes, thank you. So it's this verbiage called TROOP, true out of pocket. So that's the amount. Let me go back here. Wrong way. Okay. So that amount is going to be what you pay out of pocket and your prescription drug plan paid out of pocket. So if you're on a drug that costs $500 a month, but you only pay $35 for it and the prescription plan pays the rest, that full amount is going to apply towards the troop, towards that amount. Okay? It's much easier to understand when you see how it applies to you. There are other ways to help pay for prescription drug plans once you reach age 65. PACE and PACEnet is an absolutely wonderful program that is offered through the state. It is through the Pennsylvania Department of Aging. You have to be age 65 or older and not eligible for Medicaid. So Medicaid is the lower income insurance that is offered through the state. Income levels right here. So that's your current income. They don't look 2 years back on this one. So if you are single, you'd be eligible for PACE if you make less than $14,500, or if you're married, $17,700. PACE net gives you a little bit higher income level to work with. So married up to $41,500, single up to $33,500. PACE is going to give you the lowest copays. PACEnet is a little bit higher on the copays. PACEnet, the most that you'll pay for a brand is $15, $8 for generic. PACE is, I want to say, 3 and 6. So $3 for generic, 6 for brand. It could be a couple dollars off on those, though, so don't hold me to it. The Extra Help program is a federal program. So that one, you also have to be age 65 or older. That's through Social Security. So they go by resources, limited to $15,510 for individual or $30,950 for married couples. It includes your bank accounts, investments, bonds, IRAs, cash, and it does not count your primary residence or vehicle. When you are first eligible for Medicare, it's the federal government, so everything's kind of tied in. So when they determine your Part B premium because they looked at your income, they might say, oh, well, this person might be eligible for extra help. So you might even just automatically get an application for extra help when you start the Medicare program. So if you get that, fill it out because you might be eligible and it'd be a great help with your prescription costs. Any question about those? You guys are a quiet bunch. My last group I had was very vocal. All right, so we talked about original Medicare. We talked about Part C, which is Medicare Advantage. We talked about Part D, which is prescription drug plan. I want to talk to you a little bit about Medicare supplements. Those are secondary insurances and a way to help mitigate, lessen the cost of those deductibles and copays that we talked about if you just had Medicare Parts A and B. So because they are a secondary insurance, there is no network. So as long as you are going to a doctor or hospital that accepts Medicare, they will bill Medicare, and then Medicare sends a note to your secondary supplement coverage that says, hey, pay the rest of this. There are no referrals needed, so if you need to go to an orthopedic doctor, you can just go. They're guaranteed renewal, so you can never be dropped due to a health condition. A lot of people have concerns about that. So if you have some type of major health condition while you are enrolled in Medicare and a Medicare supplement, they can't drop you because you're costing them a lot of money. The plans are rated based on your age and your zip code. So because of that, Medicare supplement premiums do go up every year. So they can get expensive as you get older, but they are guaranteed coverage once you're in them. You don't have to ask health questions to get in them when you are first eligible for Medicare. So a lot of people that do have major health conditions end up going this route. So I did talk about how it pays secondary to Medicare. So when you would go to the doctor, you'd show your Medicare card and your supplement card. What these plans give you is predictable out-of-pocket expenses. So you know exactly how much every single year, every single month that you're going to be putting out. It's a good way to budget. Again, not for everybody, but it is one method of helping cover those extra expenses that you would have with just original Medicare Parts A and B. So these are the different supplement plans. The Medicare program is all about their letters. Okay, you have Part A, you have Part B, you have Part C, you have Part D. Now you have plans A, B, C, D. They skip E, F, G, K, L, M, and N. Okay, so try to keep in mind that when you're talking about Medicare itself, it's parts. When you're talking about supplements, it's plans. So these are the plans that are offered. You can see we talked about a lot of these things earlier. So there's a chart in your folder too that shows this and shows which plans cover which expenses of Medicare. One thing to take note is that none of these cover prescription drug plans. So this is where the standalone prescription drug plan would come into play. Any questions? Everybody's mind is just, it's a lot.
You said then the supplements are plans.
Yep, supplements are plans, and Medicare are the parts.
Okay.
Yep. So you can even see that here. They're talking about Medicare Part B. Okay, so we've talked about both Medicare Advantage plans and Medicare supplements. So Medicare Advantage, remember, is also called Part C, and the supplement. So some things that you need to know. You cannot have both a Medicare Advantage plan and a Medicare supplement. It's against the rules. You cannot have a Medicare Advantage prescription drug plan and a standalone prescription drug plan. Medicare supplements do not include your Part D prescription drug plan. And this is a big one. Your enrollment opportunities vary depending on what type of plan or what type of situation that you're in. So when you're first eligible for Medicare, whether it's due to turning 65 or you're retiring and coming off of a group plan, you have what's called guarantee issue for your Medicare supplements, which means no medical questions. And as long as you've had continuous coverage prior to that, your pre-existing conditions are going to be covered also. Medical underwriting comes into play for Medicare supplements, which means they're going to ask medical questions, and you could be not accepted into the plan if you are outside of certain, what they call enrollment periods. So if you're 65, you got your original Medicare Parts A and B, and a year down the road, you're like, oh shoot, I got diagnosed with disease XYZ. I need a supplement. It's a good chance that you won't be able to get into one at that point because they will medically underwrite, ask you those questions, and do have the right to decline coverage. Okay. For any of you that are still currently working, and if you are age 65 and currently working, this is important information to know. Based on the size of the employer that you work with, will determine if Medicare is primary or secondary to your group health plan. If you have less than 20 employees at your place of employment, Medicare is primary. So when you are first eligible for Medicare, you will want to pick up your Part B, and it's usually more cost effective to get that and then come off of the group health plan and enroll in a supplement or a Part C. If you have more than 20 employees, then Medicare is secondary, as long as it's what's called creditable coverage, which means it meets the minimum standards of Medicare. You can stay on that group health plan. You don't have to worry about any type of penalties. And when you're ready to go retire and come off of that plan, you can just enroll in your Medicare and you'll be fine.
Is there 20 eligible employees or 20 employees on the plan?
20 employees total working. Good question. There are different rules based on whether or not you're eligible for Medicare due to disability or if you have end-stage renal disease. So if any of that applies to you and you want to make sure you're doing the right thing, you can talk to me and I'll help you through that. And we did talk about credible coverage. It's just that your employer coverage is as good or better than Medicare's minimum standard. You should get a notice, or your benefits person should have what's called a letter of credible coverage that shows whether or not that is the case for your group health plan.
So what if you're older than 65 and you're retired and you have Medicare A,
Okay.
but you're on your spouse?
Are they a large employer or then, yeah, if they're over 20, then you're fine.
That's good. So why does it say, then you may have to pay a late enrollment penalty for as long as you have Part B if you don't sign up for Part B initially?
Because remember, this is wonderful words to pay attention to, especially with the commercials and everything that you read.
I checked with our HR department about that, and she said, no, they cannot charge you money always. So I'm going by that.
Yes.
I'm like, okay, I think
Yep.
that's kind of where my question is.
Yeah, as long as the coverage is credible, you will not be charged a penalty because the employer has 20 plus employees.
Because my husband is on mine.
Okay.
He's retired, so he's on mine because it's cheaper for him to be on mine than for us to pay for his Part B.
Yeah. Yeah.
It's okay.
That's fine.
It's all okay.
Yep.
All right. Just checking.
Yep.
No, it's very confusing. That's
It is.
great.
It is. And
When he was applying like 2 years ago, I read that. I'm like, but wait, I don't want to be charged a fee
And
for the rest of his life.
I mean, real quick though, he's eligible for Medicare due to age and not disability.
Yes.
Okay. Then you're good.
Okay.
It's different rules if it's disability.
Okay. No, it was.
And there's also, I don't know if this applies to anybody, but I just recently learned that there's also different rules if you're eligible for TRICARE for life, which is through if you're a veteran that's disabled or retired from the military. Okay, good question. Anybody else have any other questions before we go forward? If you're currently not working and you have a plan through Penny or you're on Cobra, Penny is the Pennsylvania insurance marketplace. You're fine until you reach 65 also. Especially if you're on Cobra, you want to make sure you come off of that as soon as you hit 65 because Medicare does not recognize Cobra coverage as creditable coverage. Again, so many different rules, so many different things that can come into play. I don't know why. I don't know that we ever heard why. They just say it's not. They expect, well, what happens is when you turn 65 and you're on Cobra, Medicare becomes primary regardless of the size of the employer. So they want you to come off of Cobra and enroll in Medicare.
I think at that point, Medicare or CMS does not view Cobra as an employer plan. It certainly is linked to the employer plan. It's identical to the employer plan, but the person has it individually. So I think that's the gray area that they're using to delineate.
Good questions. Anything else before we move on to how Social Security's works in the Medicare world? All right, so the two biggest factors with Social Security and Medicare is payment and enrollment. So when you enroll in Medicare, you can actually do it through Social Security's website, and the forms that you fill out go to Social Security's office. So we'll do the bottom one first. SSA.gov. I highly, highly recommend that if you don't have an account on there now, to go online and create an account for yourself. Not only can you see if you're not drawing your Social Security, what your benefits are, you can apply for your Social Security, you can apply for Medicare, you can do them both at the same time, or you can do them separately. There are forms, in-person or phone appointments. I'm not sure if they're doing in-person appointments yet. From COVID, I know they kind of shut that down, and I think a lot of their offices are not staffed anymore. Everybody's working from home still. But I know that they are doing phone appointments to do your enrollment. However, those seem to be like when you call, they schedule them out another 4 to 6 weeks from when you call to schedule that. So be aware of that with your time frames when you're becoming eligible or need your Medicare to start. If you are drawing your Social Security benefit prior to turning age 65, you will automatically be enrolled in Medicare. So you should, a couple months prior to your eligibility, get that Medicare card in the mail if you're drawing Social Security. They automatically put you in Part A and sometimes Part B, sometimes. Because if your employer reports to CMS, which is the Center for Medicare and Medicaid Services, that you are enrolled on their group health plan, they won't send you Part B. But if your employer did not do that, then they'll send you Part B. If you don't need Part B because you are still working, there is a form in there that you can sign and say, I don't want it, and you send that back in, and they'll send you a new card with just A on it.
But if you don't know that, and you mark A and B, and then you realize too late that you didn't need it, it takes a little while to get that turned around.
It does. You can still get it turned around, but it does take.
You end up paying that money for.
Yeah. For as long as it takes for them to get it straightened out.
Guaranteed.
Yep. Yep.
I said, I thought you had to do both. You learn.
It happens. You're not the only one that's happened to.
Good to know.
You are not the only one. I guarantee you that. Any questions about that? So again, I highly recommend creating that account with Social Security prior to becoming eligible for Medicare or drawing your Social Security. You could be in your 30s or 40s or 50s and go ahead and set that up. Okay, we've talked a little bit. You brought up the Part B enrollment penalty. So if you don't enroll in Part B when you're first eligible and don't have that creditable coverage through a large employer to cover you, you might be paying a penalty. So it's 10% of the monthly Part B premium for every 12 months you delay enrollment in your Part B. You can avoid it by enrolling when you're first eligible. When you turn 65, within 8 months after losing creditable employer coverage. COBRA is not creditable coverage. Just throwing that out there again. There are so many different enrollment periods with Medicare, okay? We're approaching what's called the annual enrollment period, which is October 15th through December 7th. That's this one here in the purple. So that's for people that are already in Medicare when they can switch their plans, shop around, and change their plans for January 1st. The IEP, initial enrollment period, is when you're turning 65. The general enrollment period is if you missed enrolling when you first turned 65 and now you need your Part B, but you missed your first opportunity. This is when your penalty might come into play. So you can enroll in Medicare in Part A or Part B. You can do it between January 1st and March 31st. However, it doesn't start till July 1st. I don't make up the rules. You'd think that would start the month after you apply. But yeah. So, and then you also have special enrollment periods, which would be when you're leaving employer coverage. If you moved and you're in a new service area and your plan's no longer offered in your zip code. And then this open enrollment period is kind of a follow-up of the annual election period where you can still make some changes there if you missed your opportunity during the annual enrollment period. Yeah, stay put once you turn 65. These can be confusing, and there's different time frames for them also. So there's a different time frame from when you lose employer coverage and can enroll in Medicare from when you have a different special enrollment period. So just make sure you know your enrollment periods, or that you're asking somebody who does, to make sure that you don't miss anything and that you're getting your coverage when you can, so you can avoid any type of penalty or going without insurance. So the agent's role, my role as an agent working with Medicare eligible people, is finding coverage for you that meets your financial and medical needs. I make sure that your prescription coverage covers everything that you have, that your pharmacy's in network, that all your doctors are in network. I'll submit and follow up on the applications to make sure everything went through. If you don't get your ID card, make sure that was mailed out to you. find the proper election periods for when you are enrolling. And then also our agency, we pride ourselves on the customer service that you get after you enroll with us. I don't just submit your applications and you never hear from me again or won't be able to get in touch with me. So if you have questions about if something's covered or a bill that you got or you lost your ID card, you can call us instead of calling the company. One thing that I do also, and these are probably going to be going out in the next couple of weeks, if you are already one of my Medicare clients, every year around this time of year, I send out a reminder card that the annual enrollment period's coming up and to call and schedule the appointment so that you have a reminder that it's your enrollment period to change plans if you need to. You probably have tons of questions, and they might not all be fresh in your brain, but they will come up. There's a form in here. This is a permission to contact form. So if you fill this out and leave this here with any of us here from the Sholley agency, they'll get this to me, and this is permission for me to reach out to you to say, hey, you have any questions? Anything pop up? Is there anything else I can help you with? Otherwise, I can't call you. I can't email you without permission to do so. So there's a lot of compliance that agents have to go through. A lot of those cold calls that you're getting are not compliant. So you can go ahead and tell them, you are not compliant with CMS, and they will hang up. Somewhere down the road. But yeah, I mean,
Initiate, and that would be okay.
you can initiate it down the road too. Absolutely. Absolutely. And again, if you have specific questions to you, yourself, any health condition you have, or something that's personal or private, we can talk later. If you have any general questions that feel good for the group, go ahead and ask away. There's a lot of information in that packet. This presentation, although it was not intended to confuse you or overwhelm you, but it is to just inform you that it is not an easy process. It's complicated, and there's a lot of information around that you hear that might or might not be applicable to you. So we can help you get through the weeds and get you enrolled in a plan that suits you.
I have a question for myself, I'm not at this point yet.
Okay.
I've been involved, my husband is,
Mm-hmm.
and I messed his up. And so can you start looking or helping with his stuff?
Yeah.
Okay.
Yep, absolutely. Absolutely. One other thing I wanted to show you. This fun little card. On the back of it, it's a great resource. Just put it in your wallet. It has the number for Social Security, for Medicare, and the PACE program. Also, if you have a smartphone, get your camera out and you can scan that QR code. Scan it with your camera, a website will pop up, touch it, and our website will come up on our Medicare page, where there's also links to a bunch of information, and you can contact me through there, and there's a card on and in your envelope. So one for you and one to share with a friend. So, and our contact information is on this hard plastic card too. Anything else? All right. If anybody wants to talk to me or one of us here, feel free to come up or reach out. Okay. Grab a snack for the road. You're welcome.
Thanks.